All right, our next question is pretty straightforward. Are COVID-19 cases really going up?
Yes, they are. Bill mentions North Dakota earlier, and I think one of the things that I've been watching North Dakota really closely, and their governor actually just signed an order that said that nurses who are COVID positive but are asymptomatic still have to come into work, and even if you're not in the healthcare profession, it's a really big deal. It's a really big deal because they are actually overwhelming their healthcare system. And so yes, COVID cases are absolutely increasing. Every state around Colorado is increasing. Arizona is just behind Colorado a little bit as far as how quickly they're increasing, but everywhere is increasing. Utah is also on the verge of overwhelming their healthcare system. Wyoming, Montana is very close to it as well. Colorado is making a mad dash towards it, and that's bad. We definitely don't want that. And so even if you're not actually in the healthcare sector, it's one of those things is you can actually see it in the hospital data. And so I was talking earlier about CDPHE has data dashboards, and one of the dashboards that they offer is actually hospitalizations. And so you can actually see the number of people that are actively hospitalized right now as of today on their dashboard. So don't believe me, believe the numbers.
Yeah, I completely agree with what Katie said. I tried to watch, and this is a good chance to dispel another bit of a mythology about this is just case count or we're doing more testing. Hospital data is, you don't get to go to the hospital just because you have a test, positive test. You go to the hospital because you need something that the hospital can provide. You're sick. For several months, the hospital data, what they do is first they look at the percentage of all available beds in the hospitals that are being occupied by patients with COVID. And for several months, that was down in the low or middle single digits. We are now at 16% of every bed in Colorado, every bed, hospital bed, is occupied by somebody with COVID. For that period of time, about 30% of the ventilators were in use. We are up now to 43% of all the ventilators in the state are being used for patients with COVID. Now, you might say, well, that doesn't sound too horrible. Well, who's not on that ventilator or who's not in that hospital bed because it's being occupied by a patient with COVID? So guess what? People are still having appendicitis. People are still having strokes. People are still having heart attacks. People are still having asthma flares. These are all these things that go on anyway that you want to make sure your hospital and your healthcare system doesn't breach. Let's just put it out there. We don't want our healthcare system to breach, so we're not able to take care of our youth. Because that would be, those people would also become victims of COVID. Maybe they didn't have COVID directly, but now they were not able to get the medical care because COVID was occupying all the healthcare resources. So those are the numbers that I keep an eye on, and yes, they're going up. Mm-hmm.
Yeah, and one last thing that Bill actually touched on, one of the things that epidemiologists in particular look at is we look at not only the number of deaths due to COVID, but also the number of excessive deaths that have happened during this time. Because even if somebody didn't necessarily die from the virus itself, from an infection with the virus, it's possible that, and very likely that, somebody who was experiencing a heart attack, they didn't go to the hospital because of what's going on with COVID, or they weren't able to get care because of what's going on with COVID. And we've seen a very big spike in the excessive deaths than most years. And, the United States has a very stable number of that's a number that you can track over time, and it's one that is pretty stable. And then this year you've just seen it spike, and that's all because of the pandemic. And so short and sweet answer is yeah, the numbers are going up, and we see it all over the place.